Hi, I'm Catherine Yetz, and today I will be discussing how to help students with obsessive compulsive disorder within your classroom. Individuals with OCD suffer from obsessive thoughts and compulsions. Such thoughts include, but are not limited to, the worry of disease and contamination, the worry of family being harmed, or the worry of not following a rigid routine, what will happen. Obsessive worries lead to obsessive compulsions, or behaviors performed to try to reduce or control the thoughts. Common compulsions include washing, cleaning, checking, repeating, touching, and counting. For example, a 6-year-old girl in Garcia and Freeman's study worried about getting sick, which led to excessive hand washing and being very particular about what food she ate and how they were prepared. Another example comes from one of my best friends in high school. She was very worried about being safe, so every night she would check her stove and check if the door was locked at least 7 times before she was able to go to sleep. Sometimes compulsions defy explanation. For example, writing a sentence over and over so beloved pet won't die. OCD in children is arguably uncommon, but it can occur with 2 to 3% of children or be found within 1 in 100 children according to Adam's study. Przeworski and Leonard note in their study that these numbers may be off, since children under 9 hide symptoms or have trouble articulating their concerns. Children have been diagnosed as early as age 3. Average age of onset is 10 years old. OCD is most commonly considered to be caused by a neurobiological explanation, such as complications in the transmission of serotonin and/or problems in communication between the frontal cortex and deeper structures within the brain. Complications with strep infection can also lead to OCD. Strep infection leads to antibodies generated by the immune system in response to infection, mistakenly attacking the basal ganglia. Life events can also play a role. The onset can be linked to a specific life event, such as the loss of a pet, a divorce in the family, or the death of a loved one. According to Adams, parents or nurture cannot cause this disability. OCD is clearly natural and neurobiological. Family stress can play a role, but it can only maintain or exacerbate an already existing condition. So, is it OCD? OCD is easily misdiagnosed. First question to ask is if there is a family history of OCD. This will increase the chances since OCD tends to run in the family. If the behavior has not been occurring that long, it is best to wait it out. If it has been going on for months, it's time to see a doctor. If a child cannot complete the repetitive behavior, or if behavior is altered and they become greatly distressed or complains more about worsening worries, the child may have OCD. If repetitive behavior becomes worse or more elaborate over time, the child may have OCD. It can be difficult for a teacher to pinpoint if a student is OCD. Young students often have particular routines and methods for their madness. What to look for is if the student often has trouble focusing at school because of sessions and at times deals with compulsions at school. This can lead to school avoidance, school refusal, and academic difficulties. These students feel alone within their OCD and have trouble relating to peers, leading to difficulties with social competence. Once the OCD is diagnosed, treatment must begin. Many with OCD start off by having cognitive behavioral therapy. This is the treatment of choice. These therapists usually do what is called exposure and response prevention, or ERP. ERP consists of gradually exposing a child to situations that trigger OCD symptoms. They begin with situations that are less anxiety provoking and build up from there. This method has been found to be highly successful. If therapy is not enough, individuals with OCD will go on medication. Many of the medications are meant to reduce anxiety, such as Paxil, Zoloft, Celexa, Prozac. Anafrol and Luvox are directly to treat OCD. It is highly advised not to just do medication alone, but pair it with therapy. A non-conventional method that is also controversial is brain implants, also known as pulse generator implants. While it does have its benefits, it can lead to impairments in frontal lobe functioning or infections can occur. Another non-conventional method is to do self-help through self-report scales. Bajorat and others found that self-help through scales worked, but usually only when paired with therapy. Overall, therapy is the most important key to treatment. So what can teachers do? There are many things they can do to help academically with OCD. Notes in the agenda should clearly be laid out for the student to help them focus, so a handout would be helpful. Sometimes anxiety can cause these students to ask a lot of questions and even repeat questions over and over. Try to minimize questions by letting the student know you're there to help and possibly write out the answer for them to hold on to. Teachers should help create a logical organization method for students. Time limits should be set on doing certain tasks so they don't obsessively work on one part. Note-taking and test strategies should be directly taught and practiced with this student. Also, shorter reading or section readings will help keep the student's attention so they don't trail off into worries. These students also have a lot of struggles with writing, so writing assignments should be shorter. Also, they can use tech tools to help with the assignment, or that you can replace writing with another method to show understanding, such as having them record it or discuss it with you verbally. These are just a few suggestions among many offered by the website OCD Education Station. I know it seems like a lot, but a little bit goes a long way. As said, it could be as simple as having an agenda for your student with OCD every single day. This will not only benefit the student with OCD, but it could benefit the whole class, creating universal design. It'll teach students how to have scheduled days and have an agenda. All the students could even check off what you're doing as they complete each task. So what can teachers do to help with having students with OCD have a safe environment? Well, a lot of these students experience germophobia. So three things that you can do is have hand sanitizer in lieu of having them going to the bathroom constantly to wash their hands. Have home books so that they're not contaminated and they can take them home to use. And then also have them be the first students to get handouts. That way other people aren't touching their papers and contaminating them. Another important thing to do in the environment is have the students seated close to you. This way you can monitor them and see, are they struggling with an obsession right now, or do they need to step out for a bit? It's also important to have a code word or a signal word that either the teacher can use to try to snap a student out of obsessions, or that a student can use to say to the teacher to let them know, I'm obsessing right now, I need a moment. Another good thing to have is breaks for the students. They can just walk out of the classroom for a bit, kind of collect themselves. You could even have them go to a safe place like the nurse or to another teacher's classroom just to have them get away and try to calm down. It's always important with any student, but especially with students with OCD, to encourage and be positive with them. Positive affirmation should be a constant within the classroom, and because they're very discouraged from their ailment, and it's important to let them know that they are important and build up their self-esteem and boost them. Another thing you can do is get involved with your students' treatment. Talk to parents and their psychological professionals about exposure and response prevention. Set goals with your students. For example, set a goal of only using hand sanitizer 3 times within a class period. Be encouraging and help your students on the path to treatment and recovery. I strongly believe books can always save the day and help students understand a perspective other than their own or understand themselves better. Some books on OCD include Devil in the Details, Multiple Choice, Passing for Normal, Kissing Doorknobs, Mr. Worry, Touch and Go Joe, The Thought That Counts, Up and Down Worry Hill, Not as Crazy I May Seem, and a self-help book for kids called What to Do When Your Brain Gets Stuck. These are all great books to share with students at different grade levels. I encourage you all to check out one or two or all of them. One thing which I can't stress enough is that OCD is completely nonsensical and will not listen to reason. This is one of the most frightening things about having it. I knew that to anyone I told, there are Salvador Dali paintings that make more sense. This quote is from Joe Wells' Touch and Go Joe. After reflecting on the quote above, think of a time you were unable to express yourself to others or hid a problem from others. How isolated did you feel? How frustrated did you feel? What other emotions came up for you? Did it affect your school or work performance or your concentration? What do you wish was done for you to help you? Imagine feeling this way every single day. Now, what could you do to help a student who feels this way daily? Write about your experience, and if you feel comfortable, please share with the class in your post. Thank you for listening to my presentation. I hope you learned a lot of useful strategies to use within your classroom for a student with OCD.